Hello, everyone. Welcome to week 10. This mini lecture is going to cover grief and loss. And after I do a brief overview of grief and loss, I'm going to talk more specifically about traumatic loss, traumatic grief. And this is a quote that I like to start off this lecture with. It says, "How lucky I am to have something that makes saying goodbye so hard." And while I think that is a difficult reframe, it can be helpful for some folks to come to that place in their meaning making process of grief when they are ready. You may have seen this illustration before, however, I think it's an incredibly useful one. It shows the complications and just the complex nature of grief. And this is an image that you can typically find online in worksheets or probably Pinterest that you could print out or have as a digital design for your clients. I think that it normalizes all of the feelings that do feel tangled up inside of a person when they are experiencing grief. It can also be a coloring sheet, and sometimes that can be helpful to have that sort of concrete activity to do in a session or in between sessions for clients. So we have to start the discussion that leads to traumatic grief talking about what quote unquote normal grief is. And as a term in general, I don't find that normal grief is particularly helpful. However, at least for lay people, for mental health professionals, I think it's helpful for us to know the differences between what we'd expect to see when somebody is sort of going through the process of grief in an expected manner versus an unexpected manner. This may also be referred to as uncomplicated grief, but it encompasses sort of all of the feelings and behaviors that happen with most people after a significant loss. And some of these include things like somatic distress, so it could be headaches, it could be upset stomach, it could be body aches. Certainly preoccupation with looking at images of the person who has passed, whether that could be maybe on their phone or social media or hard copy photos. I think just the idea of the circumstances of the death may be something that folks are preoccupied with, particularly if there's any guilt related to it, guilt of not having, maybe a better relationship or speaking to them more, or just sort of those common feelings of, things that we wish we would have done after someone passes away. Also, hostile reactions like anger, lashing out, anger at the world, anger at God are pretty normal reactions in the wake of grief. And then, of course, the inability to function like you were before the loss. That is a very normal reaction to grief. And I think that, in our culture, we want people to speed through the healing process around all things, whether it's like mental or physical. And we really need to do a better job of normalizing the fact that we should not expect people to just like pop back into work or, present as the same that they presented a day or week before the loss. That kind of healing takes time. And I think the more we can do to normalize that, the more we can do to help people have that time, the better off our culture and society would be. Some of the common feelings that we associate with normal grief are sadness and anger, which we talked about, guilt, anxiety, loneliness and fatigue, a sense of helplessness and shock, a yearning for times before the loss happened. At the same time, people may also feel emancipated, especially if maybe the person that they lost or, and I'll talk about other types of grief too. So it doesn't always have to be a person. It could be other things too that we grieve, but a feeling of freedom that we no longer are tied to that person or thing or event. Relief kind of goes with that feeling of emancipation, but that can also be when maybe someone has been sick for a really long time, or the person who is feeling this way maybe was a caregiver or something. And then numbness, which we know a lot about from learning about trauma, this term is a very common feeling. So how about physical sensations? I mentioned some of these earlier, but a hollowness in the stomach or even a stomach ache, tightness in the chest, feeling like you can't get a full breath in, tightness in the throat, feeling like you can't swallow super well, an oversensitivity to noise, a sense of depersonalization, as in you can't like feel your body, you don't feel like you're in your body, so kind of dissociation, breathlessness, and again, that inability to fully fill your lungs and breathe deeply, muscle weakness, muscle pain, a lack of energy, and a dry mouth are all physical symptoms that may go along with grief. And you'll see that there's a citation for Lindemann 1944. In these slides, that was sort of the seminal work for talking about normal grief versus other types of grief. And many other authors have built off of this, and we'll talk about some of those in a bit. Finally, common cognitions associated with normal grief are, feeling or thoughts of disbelief, confusion, preoccupation. We often do have, mourners who will have a sense of the presence of the person that they lost, and which may or may not include auditory or visual hallucinations. Again, we need to remember that this is a normal part of grief, so we don't want to pathologize that. If it were, I think one of the hallmarks of psychosis is when, something that you see or hear tells you to do things, particularly things you wouldn't normally do, things that could hurt other people, then you're looking more at like a psychosis diagnosis versus a process of grief. And some other behaviors that could happen during a time when a person is grieving: sleep issues, appetite issues, feeling absent-minded or forgetful, withdrawing from your social support, which, I feel like we do that so often when we have just tough times in our lives, and we really need the opposite. We need the social support, but we tend to have this innate sense of withdrawal. And I think with grief specifically, that comes along with the fact of people might think, well, if I don't get close to people, I won't hurt so much when they're not here anymore, which of course on the surface makes sense, but underneath we know that we all need each other to be our best selves. They may have dreams of the deceased. Avoidance is a big part of this, so avoiding reminders of the loss they had. You may also see increased sighing. There may be more of a feeling of searching and calling out for the person or a higher power. You may also see sort of a restlessness, a hyperactivity, crying. On the flip side of avoidance is they may be constantly visiting places or carrying objects as reminders, or treasuring something that belonged to the deceased person. So just like trauma symptoms in general, kind of the course of normal grief does look like different things in different people. And so I think all of this is a spectrum. And so if you find your clients on one end or the other end of the spectrum, as part of the normal grief process, you can, be with them, assure them that what they are going through is, kind of the standard for when people are grieving, which will likely help some people feel better to have that normalized. But I think with grief, much like trauma, what I want you to remember is it's okay to normalize it. It's not okay to say that everything's going to be okay. It's not okay to use sort of like false promises or things that you don't know to be true. Please don't ever say things like everything happens for a reason, or you're stronger because of this, because that can alienate clients, and instead of helping them, can actually hurt them more. So normalize, yes, but also be careful of platitudes. So over the course of normal grief reactions, the duration will often depends on what the person does with the grief work. Are they engaging in it or are they avoiding it? But some of the things that you will see happen is sort of this freedom from whatever connection they had to what they lost, a readjustment to the environment that the person is now not in, and forming new relationships. But the timeline of this can be all over the place. And it's really important that we, as mental health professionals and as just like people in society, don't judge others for, how they respond to grief. It brings to mind just a quick example I'll give you. One of my cousins died in a car accident pretty young. He was in his late 20s and was married and had 2 children. One was pretty young. And he had been with his wife since high school. So they had a pretty long history together. And she started dating and became in a relationship with someone within probably 6 to 12 months after his passing, and lots of people judged her for that and made assumptions. They'd say things like, well, she obviously didn't love him, or she wasn't very attached to him. And I often found myself saying everybody grieves differently, and we don't know what she needs right now. We don't know how she's coping or what's going on in her mind. And so I really tried to normalize whatever her process was for the rest of our family members, because I felt like those critiques were pretty unfair, because nobody could be in her shoes and everybody grieves differently. And I do think that was part of her coping. She didn't stay with that person long term and moved on. And but I think at that time that was what she needed to do to get through the day. And I don't think we should judge people for that. So just a thought. So we're going to move now from quote unquote normal grief reactions to uncommon grief reactions. So I'll read this list briefly and talk through some of these. A delay of reaction. So that could be numbness, inability to cry, inability to, move into action mode if you're the person that needs to make plans after a loss. Distorted reactions, reactions that may be over or under maybe what you'd expect. Overactivity without a sense of loss. Again, people grieve differently, and sometimes it takes a while for that feeling of loss to settle in. I've heard so many people say that they, didn't really break down until after a funeral because they were so busy before that. And the activity kept them preoccupied, but once that was all over, it really set in. You could see, and this is again an uncommon reaction, acquisition of the symptoms, that if the deceased person had an illness. It could also be a different type of medical disorder that pops up. Broken heart syndrome, I think, is a real thing, and I'm pretty sure it's in the slides later on, so I won't talk about that right now. Changes in relationships, or distancing people permanently, or making those very large changes to their support system. Hostility against specific people, and the hostility piece can escalate, especially as an uncommon reaction, into violence. So that is something you want to pay specific attention to. Psychotic symptoms, loss of personal and social initiative. Again, you have to think about timelines. Is it okay for a person to have no initiative within, several months of losing a person? Absolutely. But if it's ongoing, if it, becomes years and years of a person not wanting to re-engage with the rest of society, then that is an uncommon reaction. Behaviors changing around social and economic decisions. This is particularly alarming if someone starts giving away things, spending all their money, not going to work. It could indicate some suicidality that you would want to assess. And then also sort of an agitated depression. Depression plus irritability is also an uncommon reaction. It is important just to note that our brain changes when we're going through grief. So it's not like we just all of a sudden decide to act differently. There are parts of our brain and the chemicals in our brain that are activated by grief. And some of those things are activation of your fight, flight, freeze system, which I know you're familiar with now. The grief needs you to be able to pay attention, but sometimes that can be hard. But sort of reality is pulling you into needing to plan, needing to pay attention to things, needing to remember things, and it's pretty difficult to do that. And grief also activates, areas that deal with grief in that moment, but also more general networks in your brain too. Seems like I find one of these every time I do a PowerPoint. All right. So a little bit more about that. A person may experience a fluctuation in their hormones, which can also impact how they look after a big loss. You may notice that people seem to age kind of before your eyes, and that's often due to age-related hormones fluctuating. Specifically, after the age of 30, your body is more sensitive to cortisol fluctuations, which is the stress hormone, good in small amounts, bad in big amounts. And so, that can definitely impact how we go about our day, our energy, our ability to focus and whatnot. One thing that research has shown us is that there is a prolonged emotional response for older people. And that prolonged emotional response, or like heightened cortisol, heightened hormones, may create more risk for older adults around infection and illness. They may also have more aggravated physical pain, and the risk of a heart attack increases. And what I was referring to earlier, broken heart syndrome, is what doctors would call a stress-induced cardiomyopathy, which would be some sort of heart attack or heart issue that may happen after a long-term relationship ends and one of the partners passes away, and then the other one, their physical system just shuts down. And so you've probably read or known of cases where that happens. It is important to point out that grief and depression can look very similar, and that's why it's important to assess for loss. Even if it's just one question, if someone's presenting with depression, you may want to ask them, have you had any recent losses in your life? And I don't even mean just like deaths. It could be loss in a long-term career. It could be some sort of ambiguous loss, which we'll talk about shortly. But it's important to remember that grief reactions usually don't involve like lack of self-esteem or losing self-esteem, which we see in depression. And it's also important to note that just because someone is grieving does not mean that they are depressed. In fact, if someone is grieving, that will typically exclude them from a lot of diagnoses outside of grief, because most of the symptoms will be related to the grief and not a separate diagnosis. And depression can also serve as a defense against mourning, which means if someone is already depressed, it can be harder for them to grieve the loss and move through it in a way that, is helpful. And I think this quote from Worden is helpful too. In grief, the world looks poor and empty, while in depression, the person feels poor and empty. And that is a very important distinction between grief and depression. So now that we have talked about grief, we're going to talk a little bit more about different aspects of grief. We're going to start with complicated grief. So a complicated grief is a grief response that, due to the duration or severity, disturbs the person's functioning beyond what will be expected for a normal grief response, of all the things we just talked about, the normal grief response. So we're talking about length of time or severity, one or the other or both. And complicated grief may include different types of diagnoses, particularly anxiety or depressive diagnoses. So that is important to think about when you have clients presenting with grief, to find out, how severe their responses have been and how long this has been going on. And while I really don't like putting numbers on, moving from grief to complicated grief, around 6 months to a year is where you would typically start to see someone beginning to move through some of those normal grief reactions, even if it's not all of them, just some movement in some of them. And so once you get past, about 6 to 12 months, you are likely looking at more of a complicated grief response. There are some other types of grief that I think it's really important we talk about. And I'm going to go through each of these, but disenfranchised grief, ambiguous loss, and anticipatory grief are often terms that people, whether it's mental health professionals or lay people, clients, they don't know. They know the feeling, but they don't know that there's an actual term for it. And it can be very, very healing for them to learn that there is a term and that their counselor knows what they're talking about. So please pay attention so that you can help your clients when they are describing these types of grief. So disenfranchised grief refers to a loss in the mourner's life of relationships that are not socially sanctioned. Now, it is important to point out that this was, what I'm referencing here is from 2009 and 2002. So these may not be, as disenfranchised as they once were. However, I myself have experienced some of these, and I know other people who have experienced some of these, and I often feel like we still, like when a person experiences a disenfranchised grief, like you're still kind of left, like nobody understands, that feeling of nobody understands. So the first example is the loss of a person or relationship that is not acknowledged by the deceased person's like family, friends, or religion. Prior to the Supreme Court legalizing gay marriage, I would say that was a large percentage of this specific type of disenfranchised grief. I think our culture has moved past that in a lot of ways, and in some ways it hasn't. And so that still may be a type of disenfranchised grief that you see, but it also could be other intimate relationships that aren't recognized by the family or friends. It could be like mistress relationships. It could be even like children that happened outside of maybe a person's main family. So that can get quite complicated, but many times the person that's still alive that's not being acknowledged that they are going through a grief process can feel this very distinct type of pain, which we would call disenfranchised grief. Other types are miscarriages and abortions, which if you've talked to anybody who's experienced something like either of these, there often is a good deal of grief and loss, even when it is a choice. There's still feelings of grief, and that is okay, and that is normal, and we can support our clients while also maybe not fully understanding them, because I think that's really what we do as counselors. We're never going to understand everything, including things like loss of a pet, moving, death by suicide, or the death of someone with whom the mourner is having an affair, which I kind of talked about a little bit earlier. And I know that you may not think of moving as disenfranchised grief, but when you think about people that have to move for work, or children that have to move because their parents aren't, making that decision, it can feel like a huge loss of every, support system you have in your life. And that is certainly grief. So, things like loss of a pet, for many of us, our pets are our family members. And so that is a very distinct type of grief that maybe the world at large doesn't recognize, but that if you are a pet parent, you certainly know that the loss of a pet is a serious loss. I would also say death by suicide is not something that we particularly view anymore as like not legitimate grief. I think our culture has come further now in accepting that when someone kills themselves, they are in a lot of pain. And at the time, that probably felt like the only solution. And so we need to support the people that are grieving. So that's disenfranchised grief. It is sort of a subset. And then let's talk a little bit about ambiguous loss. So this is a loss that is either psychologically present but physically absent. And some of these examples would be kidnapping, a natural disaster, giving up a baby for adoption, or absentee parents due to divorce, or someone who's physically present but psychologically absent, such as through Alzheimer's or other types of dementia or traumatic brain injury. And, in both of these circumstances, there is a presence, whether that's psychological or physical, and then there's a lack of presence, which is the opposite of whatever the presence is. And that can be really, really hard for people to put words to, why am I grieving when I know that the baby that I gave up for adoption is still alive out there somewhere and having a good life? Well, that's ambiguous loss, and grief is a normal process for that. Just because the baby is still out there doesn't mean that your client doesn't have feelings around, them not being with the child. And then lastly, anticipatory grief, and this is probably the easiest of these three to define, but it's grief that occurs before an impending loss, and it's almost always due to some sort of serious illness where the family and friends know that the person is going to pass away. And it can be experienced by the person who is dying, who also probably has a good idea that their time is limited. And it can be really powerful to do end of life therapy with someone around anticipatory grief. It can also be very powerful to do this with the family members because it often helps them, in whatever ways they can be more prepared, more present with their loved one, and, more available to working through the process. So there are a couple of models, which you've probably heard of, that talk about the stages of grief. And one of those are Kubler-Ross's stages of grief. These are denial, anger, bargaining, depression, and acceptance. And when Kubler-Ross first talked about these different stages, people did assume that they were linear. So you go from denial to anger, anger to bargaining, bargaining to depression, and depression to acceptance. However, we do not really believe that these are linear anymore. In fact, all evidence points to them being cyclical, and also not just cyclical, but that you can bounce back in between. So I would say, these are real stages of grief, but there's no specific order to them, and you don't just move through them once and then you're done. And the clip that you see here is in your Canvas module. It's the giraffe stages of grief, and yes, it's a cartoon and it's kind of funny, and they bleep out the bad words so you don't have to worry about that, but it is just an illustration of the stages of grief. Next, we have a more updated sort of version of what happens when a person is going through grief, and these are Worden's tasks of mourning. So task number 1, to accept the reality of loss. Task number 2, to work through the pain of grief. Task number 3, to adjust to an environment in which the deceased is missing, not there anymore. And task number 4, to find an enduring connection with the deceased while embarking on a new life. I have used this model in working with clients going through grief before, and I find it pretty helpful for at least myself to know, as far as like organizing sessions and, trying to have some plan for a session. I also will try to look at what stage of grief I think they're currently in, and then also what tasks that we are working on in counseling to create a treatment plan. And so I think that when you put these two together, they can be really helpful. All right, let's talk a little bit about grief and crisis. So crises do result oftentimes in some sort of loss. And it could be a death, but it also could be something else. It could be loss of a house, it could be loss of a job, it could fall under ambiguous or disenfranchised grief. However, during a crisis, if grief is experienced, there are a couple of things that you can do to help the client. So these are going to sound familiar because they're going to be similar to what you would do sort of in a trauma intake and or psychological first aid. So reflect feeling without judgment, hold space for the person to just sort of talk through whatever they're feeling and thinking. Normalize all the different feelings that we get when we are going through crisis and loss. Allow that space for anger and resentment to come out, as long as you aren't physically in danger and the person is expressing those things through appropriate means like verbally or whatnot, then give them the space to do that. Show that you care, that you're listening and you're empathic. So the last little point here, tell them they'll get through this, question mark, touching, question mark. I have question marks by these because I'm curious what you think about these two ideas. Like, should we tell clients that they'll get through this? Should we, touch a client in a non-sexual way, obviously, during grief and crisis? So, I kind of don't want to give you an answer here, but also this is a recording, so I feel like I have to. Again, be careful of platitudes. So I'm not sure that I would use the exact phrase, you'll get through this. But I might, especially if I know the client, say things like, you've been through a lot, you're a very strong person, you have good support, so things that I know to be true. I would not go to platitudes that may or may not be true and I can't ensure are true. And then as far as touching goes, I think in any like trauma, crisis, grief included, that's very personal and really between you and your clients. Like, are you a touchy-feely person? Is your client a touchy-feely person? And so I've certainly put my hand on client shoulders or arms before if we, if both of us feel like that's appropriate or we've talked about it before or something. I've given clients hugs at the end of sessions, always with permission. I've also hugged my own counselor, also with permission. So, I think that just talking through these things, even if it feels weird, we do need to normalize consent over any kind of touching. And so just making sure that you have conversations with your clients about how they feel about touch, but also don't feel like you have to give up your feelings about it. If you're a no toucher, that's totally okay. You don't have to hug your clients. You don't have to put your hand on their shoulder or anything like that. So I think that having your own boundaries is also really important. So this is a model that just kind of shows what might happen when trauma intersects with bereavement. So trauma without bereavement, you have the traumatic event, but there was no death involved, but you have your trauma symptoms. Bereavement without trauma, you have a death or a loss, but there's no traumatic event. So you have normal or possibly complicated grief, depending again on severity or timeline. And then with traumatic grief, I don't know where that came from. You have the death of a loved one, traumatic or complicating circumstances, and then you have trauma plus grief, which can be quite overwhelming. And traumatic bereavement often happens when, things happen that a person may have witnessed or have details about. It could be a violent death. It could be witnessing, severe illness. And so there are different types of trauma that can come about from a loss. So here are a little more, here's a little more information about trauma and grief. Some things you can ask when you are trying to figure out if something is traumatic bereavement. What is more important, the circumstances of the death or the reaction of the client? So are they, if the circumstances of the death are more important, then you're probably going to be looking more at trauma. If it's the reaction of the client, then you can look at that and say, well, this falls under either normal grief or possibly complicated grief. And then ask yourself which symptoms should be addressed first. There's no one right way to do this. And so, you can base this on the client and their symptoms. But we do know that the trauma will interfere with the grieving process and the grief will interfere with trauma mastery. So, sometimes this will need to be a conjoint process. However, I always go to what symptoms are the hardest for the client to deal with. If it's grief, I'll go there. If it's trauma, I'll go there. But there is some research that indicates that we should address the trauma symptoms first so that the grief can be moved through. And many times when grief is traumatic, the trauma symptoms will be stronger as far as like day-to-day functioning. So that is where you go first, sort of naturally. One thing that's really helpful in dealing with grief and loss is the process of meaning making. And I'll talk about this a little bit more in the next week when we talk about resilience and post-traumatic growth. But meaning making occurs, when we are able to sort of move past the loss and the trauma and be able to figure out what the aftermath means to us. And there is no cut and dried process or meaning that everyone is going to reach, at the end of or in between their grief processes. So this quote from Worden says, when unanticipated or incongruous events such as the death of a loved one occur, a person needs to redefine the self and relearn ways to engage with the world without the deceased. The person cannot return to a pre-loss level of functioning, but learns how to develop a meaningful life without the deceased loved one. And when you think about it, that is absolutely what we have to do if we're going to go on living after we lose someone. We're never going to go back to that place where that person was always there with us. But we can figure out what's going to work for us going forward. And in general, like this is the overall goal of grief and loss therapy, to help the person get to the point where they are able to develop a meaningful life without their loved one that they lost. Which is why it is considered a central process in mourning. So how do we do that? Typically we use narrative, just like in a trauma narrative, we'll use a narrative or life stories. There are lots of creative ways you can do this. This doesn't just have to be through talk therapy. It could be through creative writing, poetry, art, collaging. There are lots of different ways to create life stories. I think that when you're talking about a life story, you want to start somewhere before the person whom they lost was in their life. Now, that's not always going to be possible, especially with parents. But you do want to focus on parts of the story where the person was sort of independent or doing okay without the person who was there. And then you also want to acknowledge the parts of their life that were better, happier, more content, etc., with the person that they lost. And so this is also sometimes called meaning reconstruction, so we are helping the client really learn to re-engage with the world in a different way, in a different meaning making actions. So they can't return to their pre-loss level of functioning, but they can create a new life. And so the next part of the narrative after history is future. What will my life look like now? What did the life of my loved one mean to me? What are my takeaways from that? What are things that I want to appreciate more, that I want to seek out, or that I don't want to do because I learned these things from them? How can I feel safe in a world like this? I mean, that is a complicated question, right? And building social support, the client has to answer that for themselves. For some people, it will be religion. For some people, it will be advocacy and trying to leave a better world than the one they're in. For others, it'll be just having a strong, friend, family network. And then who am I now? Or who do I want to be moving forward? And so this is a process, it's not an outcome. It can't be forced on the mourner or your client. And it often doesn't have a distinct end because I think that this is an open-ended process. Like our process of becoming is our life's work. And so we never finish that until we're not here anymore. And this is, you know, the same process when you lose someone. So some other treatments to consider are obviously addressing your trauma symptoms if they're present, and then processing the grief. CBT and ACT, which is acceptance and commitment therapy, may be helpful. Narrative exposure is another potential, you know, treatment option. Group counseling is also particularly helpful for grief and loss. And so I think that if you find yourself working with a lot of clients who are grieving, a group could be a very helpful intervention. Please remember that everyone grieves differently and everyone has different rituals and norms around mourning and how they cope with a loss. And their cultural background will often dictate that. And so let the client tell you about those things. Be open to learning, be non-judgmental, you know, give that unconditional positive regard. And become as comfortable as you can talking about different aspects of religion and spirituality. Existential concerns are often very central to the meaning-making process. And, you know, I have seen clients go opposite ways. I've seen, you know, I had a client who after a really rough miscarriage became much more spiritual. And I've had a client who after, you know, dealing with the loss of a loved one through a really bad cancer diagnosis and, you know, very difficult death, kind of decide that they did not have spiritual or religious beliefs anymore. And so as the counselor, we need to be open to anywhere on that spectrum that a client falls when they come in and they are looking to, you know, help with grief. And then I have a few more resources for you here, a sample session, a meditation for coping with grief, a clip from Inside Out on the stages of grief, and a bit on transforming traumatic grief. And I want to say I might have put that last one in the module for you, but I'll also put this PowerPoint in there so that you can click on these links for yourself. So thank you so much for your time today. I hope this was helpful. This is just a small snippet on working with trauma and grief. It can be a complicated process, but I think it's also one of the most needed for our clientele, for somebody to be with them and be willing to hold them in their loss and their grief as they process through it. And even if you are just a general practitioner or you specialize in something else, someone is going to come into your practice that's grieving a loss. And so you need to be prepared, even on a smaller level, to be with the client through that. So thanks so much and have a great week.